In 2000, when I began my treatment, I used to pay $400 a month. It was, of course, impossible for my family to continue paying the treatment, so I just dropped off.
In my own country, it is still a problem. We have lowered the deaths from TB, but it's still too high. 80% of HIV-positive people in South Africa who die is because of TB.
We have 37 million people who live with HIV, but only 15 million have access to treatment.
HIV, tuberculosis, and hepatitis C claim 3.2 million deaths annually. Over 85% of people suffering from these diseases live in low and middle-income countries. But the vast majority does not have access to treatment, an issue that UNITAID decided to address by creating a unique patent pool working to increase access to new treatments in developing countries.
The Medecines Patent Pool is an initiative supported by the United Nations, and it is a unique mechanism that encourages collaboration among many actors in public health to license medicines and then distribute the less expensive versions to developing countries in great need.
The Medecines Patent Pool works with a series of stakeholders: civil society, governments, UN agencies, and the private sector. Now, we do this through a system of what we call patent sharing or patent pooling and voluntary licensing with IP holders. Patents are an important part of stimulating innovation. But at the same time, if we want to make sure that everyone has access to these new innovations, we have to ensure that these patents are actually shared.
The Medecines Patent Pool is working to improve access to HIV, hepatitis C, and tuberculosis medicines through a voluntary licensing and patent pooling model. This is how it works. Disease experts, civil society, patient groups, and the World Health Organization help identify treatment needs and prioritize medicines. The MPP negotiates with patent holders and signs voluntary licensing agreements for these medicines, and then licenses rights to generic companies to manufacture and distribute affordable versions in developing countries. The licenses allow generic companies the freedom to develop new treatments, such as fixed-dose combinations and special formulations for children. Competition amongst low-cost manufacturers brings prices down, and more people gain access to the medicines they need.
Laurus Labs is working with the Medecines Patent Pool for the last 5 years, and we are currently producing 7 APIs through these licenses. Medecines Patent Pool not only give licenses while working with the innovators, they also do a lot of forecasting work, especially in HIV treatment, that will allow generic companies like Laurus Labs to put up capacities, gear up for procurement, and to deliver what market needs, what the low and middle income countries need.
Since the creation of Vive Healthcare in 2009, we made a commitment through voluntary license agreements to accelerate the access of our HIV medicines to countries where the HIV burden was the highest. Since 2013, thanks to the partnership that we set up with the Medecines Patent Pool, affordable generic version of a new antiretroviral agent, dolutegravir, and pediatric formulation of abacavir could be made available to 92% of adults and 99% of children living with HIV in the developing world, following local approval.
It's very important, of course, to have medicaments for children, but there's no longer a market because that justifies the research and the development of new drugs, not necessarily new drugs in terms of new molecules, but new formulations which are adapted for children. I think this is a typical area in which entities like UNITAID and MPP working together, and sometimes working together with other organizations, of course, can be very important.
We see the Medecines Patent Pool as one of the key players in increasing access to hepatitis C medicines, because we needed that innovative mechanism that the MPP provides to help countries access high-quality, low-cost generics.
Over the last 6 years, MPP has signed licensing agreements with 9 patent holders for 12 antiretrovirals, 2 hepatitis C antivirals, and a tuberculosis treatment. MPP's generic partners have distributed more than 4 billion doses of low-cost HIV medicines to 125 countries. A tremendous result, which is increasing at a fast pace. The MPP is now working with 15 generic manufacturers on more than 100 development projects and is expected to generate significant savings in the coming years.
You are aware that we are running the biggest antiretroviral therapy program in the whole world. We would not have been able to do so if it was not for generics, you know. And most of the generics, we acquired them facilitated by Medecines Patent Pool, or at least influenced by them. In other words, companies were now willing to give voluntary licenses for others to manufacture generics.
I think it's very important when you think of the business models of MPP or Unitaid, not to lose sight of the humanistic objectives. It's not only efficiency is important, but of course not losing sight that in the last resort, what you are talking, the bottom line, you are talking about saving lives.